Infertility is actually a very common disorder. It affects about 10% of couples during their reproductive years. So one of the more common medical conditions, illnesses for that age group. The average age of menopause is 50, 51, but the probably decreased fertility becomes 10 years before you're going to go through menopause. So, and none of us know exactly when we're going to go through menopause unless we have a family history of early menopause. But probably 10 years before that last period, women are going to see a decrease in fertility. And so we think about it beginning at age 40, but it may be sooner in some women. So age is a factor. The likelihood of pregnancy and the risk of pregnancy loss, miscarriages, goes up as we get older. Infertility, really the way we look at it is that it can be due to a male factor, so decreased sperm number or motility of sperm. It can be due to a female factor, either inability to produce eggs or a problem with the eggs and sperm getting together. So the tubes and the uterus have to be normal. And it's about 40% male factor, 40% female factor, and about 20% are unexplained. So we can't find a reason with either eggs or sperm, and then we're left with that lack of an explanation. The man has a semen analysis, just collects a sample, sperm number and movement is measured. The woman documents that she's releasing eggs. That's fairly easy to do with over-the-counter ovulation predictor kits, or we can check a hormone level. The woman then has an x-ray to make sure the uterus and the tubes are normal and open. And if the woman is a little bit older, we'll sometimes look for any sign of what we call decreased ovarian reserve or pending menopause. About 3% of couples who've been trying for a year and haven't gotten pregnant, about 3% get pregnant each month they try. So there's always that chance of getting pregnant. So the treatments are to boost the chance of getting pregnant each month they try. The simplest treatment is to use a fertility pill called clomiphene citrate along with timed intrauterine inseminations, which basically means putting the sperm close to where the eggs are, so putting the sperm into the uterus at the time the eggs are releasing. That treatment gets about a 10% chance of pregnancy each month it's done. In vitro fertilization, which was just starting when I was in training, has now advanced to the point that the chance of pregnancy with in vitro fertilization is about 35 to 40%. So a good chance for pregnancy. You'd still expect you have a healthy embryo from the eggs and sperm that's put in the uterus, that it might even be higher than that, but that is actually something that we've really seen progression over the years.